You have to come to.
Hey, Ricky.
Hey Mo, the doctor
The
is in.
the doctor is in with a special birthday message. Listen, everybody, stop what you are doing. First of all, I'm trying to see if the listeners will come up. They're not going to come up for me because technology hates me. But stop what you are doing and let's wish Ricky Fairley a happy, happy, happy 70th
Do we
birthday.
have to say the number? Can we just say? I don't want
Happiest birthday. Scratch it from the record. There you go. Listen, how you
to.
feeling?
I'm great. I'm in Kenya. It's 1 o'clock in the morning here, but I'm on my like little birthday journey. And Kenya is a magical place. Everybody should come here, and however you get here in your lifetime.
Isn't it
I've
gorgeous?
I've seen lions and elephants and giraffes and zebras and gazelles, and I even saw gosh, I saw all the animals, a leopard, and and it's amazing. And today I picked up a starfish. I'm
What?
in Mombasa. Yep, they're like the coolest red
Wow.
fish. I'll send you a picture of it. And the people here are just
Yeah.
amazing. It's a magical
Yeah.
place in your words. So
Wow.
so so we're gonna maybe I don't want to say Chilo, but I went back and we're talking about Martha's Vineyard. Like we're
Speaking of
gonna
magical places, right?
right magical places. So we're getting ready for our big magical vineyard. I mean big Martha's Vineyard Touch Talks Wellness event in August. It'll be August 12th to the 20th this year. And I went back and I started looking at some of the episodes of the stuff
Hmm.
we did last year, and they were amazing.
Yeah.
We did two shows there, Mo, remember? But I
Hmm.
actually was going to pick out an episode to watch today,
Great.
and the one I picked was actually the finale show. So
Awesome.
the finale show was the last show that we did there, and it was
Mhm.
kind of like we called it like the kitchen sink show
The recap. Yeah.
recap. So we're going to do a little remix here. But the two people that were on, the two guests were Dr. Link, Glenda
Hmm.
Newell-Harris, who's the
Yes.
16th past president of the Links Incorporated, and our other Link sister, Stephanie Cummings-Carr. And
Yes.
she talked about, remember, she talked about her endometrial disease, but I think, but Dr. Glenda
Yeah.
an advocate. She wrote this book about advocacy and everything. I'm just going to talk some quick notes of what she said. We talked
Mhm.
about being the CEO of your own health, what we always talk
Right.
about. So many themes that we always talk about. You can fire
Hmm.
a doctor. And she actually said it's a crazy thing, but don't fire your doctor until you found another doctor. Don't leave yourself hanging, which is
Good
interesting,
point.
right? Right. Go get that second opinion or that third opinion, but have a
Yeah.
backup plan, right?
Right.
She
Right.
also said, if you don't think you're ever going to need a doctor, keep on living. And I've been saying that a lot to doctors lately, Mo. When I've talked to doctors, I said, at some point you're going to trade in your white coat with your name on it to the little
Hmm.
white gown that the patients wear with your butt hanging out.
Hmm.
And that's how we should think about health, right? So she
That's
talks
right.
about doctors, but she also talked about the importance of good communication. How are you talking to your doctor? Bringing
Precisely.
someone with
What
you.
and what information are you bringing with you? Because we're going to ask, how long's it been going on? Is it the first time? Did anything make it better? Right.
Right.
And so we got to take some stock. You're right.
Get some stuff with us, or you're going to go in there with your AI analysis of what your symptoms are. And
Mhm.
then, so what does that really mean? That what do you really know? What don't you know? And make sure you have the right questions. And then she said, then you can sort of talk about navigation, like how you
Mhm.
navigate this conversation, who's going to help you, bring somebody with you, and then you'll
Yep.
have advocacy. So I think it's a really great episode. And then Stephanie talks about her story, which I'll let this episode speak for itself. But it's really pretty cool. So
Love
I'm
it.
gonna
I love it.
I'm gonna share it
All
and
right. Share your screen. Make sure you share the sound. Yep.
yep. I'm so glad you reminded me of that. And I think it'll be a really interesting Touch Talks Wellness.
All right, let's do it. And while we're at it, this is the doctor's in, and we're talking about our time in Martha's Vineyard because it's coming up again this time, August 12th through the 20th. So, mark your calendars and like, follow, and share.
Yep, we'll be on live every day. Probably like somewhere between like 10 and 1 every day, every morning. And then we'll do 2 episodes of The Doctor Is In, mash
Mhm.
up with Big Table Talk. And we have a great lineup. We're going to do a cancer day. We're going to do a cardiology day, a heart disease day. We're going to do a mental health day, a policy day, a women's health day, and a men's health day. I will put the Eventbrite link in the chat. Haley's actually named every episode after a song.
Oh, I
So
like
I
that.
know it's pretty funny. So like I'm every woman is the women's health day. I don't remember them all, but they're all in the event. You can see what we're going to do and sign up to either be with us or watch online. So
There
here we
you
go.
go.
I'm going to hit play
All
and
right. Share your screen and that's it. And yep. We'll go
here we
full
go.
speaker.
Yeah, can you see this?
I can.
Okay, we are live from Martha's Vineyard. This is our grand finale. We're going to talk about everything in the kitchen soup. So join us.
Okay, everyone, we're going to go ahead and get started today. We are here for our, it's crazy to say, but our very last day of Talks Wellness 2025. We have had an amazing 2 weeks of programming. We have covered mental health. We have covered clinical trials, the Black cancers, so many more policy, cardiology, and we had a family day as well. And today is our kitchen sink conversation called the grand finale. We want to make sure we have time to cover anything that wasn't really talked about, as well as highlight some amazing new panelists that we have here today. I am not moderating, my mother is here, but I just wanted to get us to start off. And if you guys don't mind, can I show a video first?
Yeah.
Okay, cool. I'm going to show a video from our pharma partners at AstraZeneca. This is a video that was sent to us, and I want to, on the day that, like, the one day our Wi-Fi didn't work. And so we're going to play that first. It is about clinical trials, and then we will jump into our panel.
Really good partner. They sponsor pretty much everything we do. And we're working with them to recruit Black women for their breast cancer trials. And so we provide our nurse navigation for them. And
here we go.
They're our partner. I mean, right now.
My name is Kelly Williams. I serve as Global Senior Director of Patient Sciences at AstraZeneca. Every day, I think about the individuals whose futures depend on the next breakthrough in breast cancer care. Yet the reality is stark. Black women represent just 3% of participants in breast cancer clinical trials. 3% of the very research that could one day save lives. This gap is not a statistics we can glance over. It is a crisis. But the science meant to save lives does not reflect everyone that it serves. We risk delivering solutions that leave entire communities behind. In breast cancer research, representation isn't a nice to have. It's a matter of life and death. At AstraZeneca, we're determined to change that reality. We're bringing the human story back into the heart of the data, partnering with patient advocacy groups, community champions, and policy leaders to listen, learn, and rebuild trust where it has been fractured. Our decisions are anchored in equity, representation, and measurable action. This means reshaping the scientific landscape, launching inclusive research platforms, pioneering combination therapies, and expanding indications so our treatments are effective for everyone. And we're not just talking about change, we are creating it. On September 30th, we will host our Readings of Change Jazz Brunch in Chicago, a safe and welcoming space for community leaders, healthcare experts, and advocates to come together. In partnership with Touch, we will amplify the urgency of increasing Black women's representation in breast cancer trials. Through open dialogue and evidence-based discussion, We will identify actionable solutions and build a foundation for sustained progress. By putting equity into practice, humanizing our science, and ensuring every voice shapes the way forward, we move closer to a future where breakthroughs are not only possible, but equitable, transforming outcomes for all patients everywhere.
So if you're in Chicago, join us for a jazz brunch. And if not, that's something that we've been working to take on the road over time. So we are now going to jump in. We have some amazing panelists here, so let's go ahead.
September 30th in Chicago, be there. So I first want to introduce my precious Link sister and the 16th past president of the Links Incorporated.
Thank you so much.
National president.
Thank you so much, Ricky. It's an honor to be here, and I'm very excited about all the great work you're doing, and especially on the island for the last 2 weeks.
I saw her the other day and I scooped her up and said, you have to come over here. And my Link sister, Stephanie Cummings, provide. Introduce yourself, please, Miss.
Thank you. Thank you. My name is Stephanie Cummings-Carr, and like Ricky, as she mentioned, we're also in the same Silver Spring, Maryland chapter of the Links. And she thought it would be great for me to come and just share my journey of endometriosis. Not really cancer related, but I was seeing an OB oncologist for many years, and the disease is often treated as if they're treating cancer patients. So she thought it was relevant enough for me to come and participate here this week. So it's an honor to be here, and thank you for having me.
Great. So we really want to talk about anything and everything and I'll let these lovelies talk about what they do and what their experiences are and share their stories. But we also wanted to talk about caregiving and just family health overall. You know, I think one of the things that we've been trying to do for the past, I guess, 14 days on here on the vineyard is to bring these important health conversations to the kitchen table, to the beach, to the porch, to your families, to our families, because the secrets that Black people are keeping in our families are killing us. We have higher mortality rates of most diseases. We have higher incidence rates of most diseases. And even all the cardiovascular diseases, 80% can be prevented. And we have a kosher who spoke the other day about her cardio. We may call her up here too, kosher. But I think, you know, whatever, you know, we just can't make these conversations more frequent than they just need to be on the table all the time. And we shouldn't be dying of something or have something in our family has already experienced. We also know that we don't get a lot of genetic testing. And even though genetic testing is really good and critical and important, it still only represents about 5 to 10% of cancers. I don't have any genetic mutations, but I have 3 generations of cancer in my family. So my daughters are at risk. And that's because, guess what? The genetic testing was based on white genes. And we now know in the breast cancer space, which is, you know, our lane, that a Black breast cancer cell looks totally different than a white breast cancer cell under a microscope. So I have my blessed Jan here to talk about breast cancer, but really we want to just put everything on the table. It's our last day here. So if you guys have anything you want to talk about, let's talk about it. But why don't we start with your story, Steph?
Sure. So I was diagnosed with endometriosis in my early 20s. I was diagnosed by a physician. So endometriosis, would have me explain it. It is basically when you have your menstrual cycle, and Dr. Glenda can probably better describe it than I can, but when you have your menstrual cycle every month, instead of your flow coming out, some of it lingers behind and attaches to the uterine wall, and it can be very painful over time. And then it builds up adhesions. So the only way to treat it is oftentimes they put you on this Lupron drug, which puts you like in a menopausal state, and you can stay on that for an extended amount of time. And then when the adhesions harden, then they want to go in and do surgery to remove those adhesions in the uterine lining. And that process went on for me. I had 7 surgeries over a 25-year period. And endometriosis can appear anywhere in the body. It can appear in your hands, in your legs, in your knees, in your hip. Mine was always bowel related, which was very painful. So my first surgery was in '01. It had attached itself to my intestines. I had part of my bowel resected and reattached. Then a second surgery, I had my urethra retransplanted. It would just keep coming back. It's like a cycle. It's like cancer. You go in, you get treated, it comes back again. So I really didn't have a lot of, I had a good surgeon that knew how to go in and treat it and remove it, but he really didn't have a mechanism for how I could prevent this from reoccurring, how I could get better. I then started seeing a nutritionist who put me on a complete organic diet. I was doing all my shopping at Roots and Whole Foods. I did that for years. It helped, but not a lot. It did help. Stress. I was in software sales at the time. And my surgeon, after the third or fourth surgeries, and I'm going to be honest with you, Stephanie, a lot of what you're experiencing is stress. You might need to look at another career if you really are serious about having this just go away and not return. Well, at that time, that just wasn't an option. I've been a software salesman all of my 30-year career. I don't know anything else, quite honestly. Fast forward 2016, 2017, I got really sick. I was in bed for 2 weeks. I thought I had the flu. I mean, I was so sick I couldn't get my head off the pillow. I finally had my cousin take me to the emergency room. It turns out I had a urinary tract infection, but I had no symptoms. Now, we're all ladies. I'm sure many of you have had UTIs before, and when you have them, you know you have them. You are on fire down there. I had no symptoms whatsoever. And I remember the nurse came in. I had the urine in this cup, and I set it on top of the table near the bed. She said, Stephanie, you have a really nasty UTI infection. I'm like, really? I said, is that why I'm so sick? And she said, yeah. And I also noticed the urine in my cup was like a really dark, burnt, like burgundy color. Hadn't paid it any attention. I stayed in the hospital a few hours, left around 3 or 4 o'clock in the morning. They gave me some antibiotics to go home with. Went home with them, was in bed Saturday, Sunday. Monday, I still wasn't feeling any better. I called my OB oncologist, Dr. Paul McGould. He's based out of Bethesda, Maryland. Told him what my symptoms were. He said, you know what, why don't you come back, Stephanie? We're just going to admit you. I was in the hospital for 7 days. My body became septic because I had gone untreated with this UTI for so long. You know, I was admitted. I was in the hospital for 7 days, very sick. And eventually the antibiotics did help. I started feeling better. They sent me home. But what was shocking, I was sharing with Dr. Glenda, my period never came back. I went into menopause. That UTI infection and the whole infection and sepsis caused me to go in menopause state. And I never got my cycle again. I was 43 years old. So the bittersweet part is my endometriosis went away. I never had any more pain after that. Now, let me just share, during my 25-year cycle with endometriosis, I was trying to manage pain every single day. You know, every month my period would come, like I was taking 800 milligrams of Motrin a day just to get through the day for years and years and years. And that just became my norm. So to have it just dissipate and go away like that was really a blessing. I knew that was the end of me being able to have children. I was not able to have children. I looked into freezing my eggs 20 years ago, but I was discouraged from that because the technology wasn't as advanced as it is now. And it was very expensive as it is now. Not as expensive, but I remember my physician telling me, I don't want you spending that kind of money because I'm not guaranteed that you're not going to have mongoloid kids when you get ready to process these eggs. So we're not going to do that. But I share with young people, I have a lot of mentees, a lot of young, beautiful Black girls that are in their 30s, unmarried, trying to meet the right guy. It hasn't happened yet. And we have those conversations. Well, Stephanie, what do you think? I tell them in a heartbeat, if you're going to spend 25 grand to buy a car, spend it to freeze your eggs. You know, don't get shut out like I did. If I had those options, I would have done that. You may not, you may get pregnant on your own naturally, but in the event that you don't, you can still have a baby at 50, right? When you freeze your eggs. So, and I know that can be a very controversial subject, but if they ask me my opinion, that's what I'm very quick to tell them, you know. Anyway, I'll pause there. Any questions for me? Yes.
I had one. When you said you were 800 milligrams, was that every day or just when you had it?
That was every day. So even like, it was really worse when my period would come. Then my cycle would end. But the endometriosis pain, that's when it really starts to linger and cause you just a lot of discomfort all the time. And it's interesting because that's dangerous to take that much Motrin, and it causes problems with your kidneys. So up until a few years ago, I started experiencing stage 1 kidney failure, but I was overweight. I wasn't exercising as much. I was being treated by a kidney specialist. And just recently, I'm down 30 pounds, by the way, and I feel amazing. I've been doing Wegovy. I don't know why that's such a big secret. It's worked wonders for me. But because my weight is down, because I'm exercising, and I run 3 miles every day, I'm doing that for a long time, a long, long time. My numbers are back normal again. I don't have the high protein in my urine count that I did. So I said to my doctor, what is this from? He says, well, he said, keep it down, because I noticed when my weight fluctuated, my protein increased in my urine. And we never want to have protein in our urine because that's stage 1 kidney failure. And I said, well, do you think it's from that years of abusing Motrin, which is really what I was doing? He said it didn't help. I won't say that's what it was from, but that certainly didn't help. So, but I had to do that just to get through the day. I still had to work. I had a career, right? And I can remember how it impacted my just quality of life. You imagine just being in pain all day, every day, right? You know, you go to meeting. I would actually schedule calls around when I knew my cycle was going to come, because I knew I'd be in bed for 2 or 3 days. You know, it's crazy, but yeah.
Chronic disease, right?
Yeah, I have a question.
Mhm. Yep. So I was having really bad menstrual cramps every month. That's how I was diagnosed with it originally. I can't remember, Dr. Glenda, maybe you know how I was tested for it. It's been so long ago. But he called me in his office and he said, have you ever heard of endometriosis? I have not. He says, well, I think that's what you have. I'm almost certain. And he gave me an examination. And I think I was put under for that. And he did see the adhesions, and I think he treated me for them early on and started me on, at that time, Lupron was like the go-to medication. And all it does is really, it's just a Band-Aid, really. And you're on that for a few months. It pauses your cycle. And while you're not having your period, you're not having pain or discomfort. But as soon as you go in and they remove the adhesions, I was fine for a little while, and then it comes right back again. Yeah, but I will tell you, diet is very important. Like I said, I was on a complete organic diet for many, many years, and it helped. Didn't take it away, but it did help.
I think you raised 2 really good points, that if you don't even have endometriosis, and yet you raised it, is if you feel something that feels weird in your body, you know your body better than anybody. We all have to be the CEOs of our health.
Mm-hmm.
And if you think something's going wrong, it could be. So go check it out. I think so many diseases are diagnosed later than they need to be, because we dismiss it. And a lot of cancers are diagnosed by back pain. We all have back pain, right? But whose back doesn't hurt someday for something, right? And we say, oh, it's a muscle. I pulled a muscle. I worked out too hard. I walked too much. Whatever. If it's consistent over a couple of weeks, you need to go check it out. Or any symptom that you feel is weird, you need to go check it out.
Yeah, one more thing I wanted to mention. For whatever reason, most of the physicians had said to me, Stephanie, if you have a baby, so oftentimes endometriosis goes away. They don't know why. They can't explain it. I was not able to have children, so I'm sure that did not help, right? It really just lingered on the disease for so many more years. Had I had my children in my 20s or my 30s, I probably wouldn't have had that journey of endometriosis, but it definitely does help. They said with women, once you had your children, my mom never experienced endometriosis, but my sister doesn't have children. She's never had endometriosis, so it just depends. So that was one thing that, yeah.
Yeah.
Another sign of the endometriosis is the constant cramping. The period is over, but the cramps continue to remain. Period is over, you're thinking, oh, I'm gonna get some relief, but then into the next weeks or whatever, you're still having this pain. And so that's not really normal, right? And so I feel like we know that oftentimes our pain is just put on the back burner. People aren't really paying attention. And it's like, well, just take an aspirin or whatever, but that's not normal. So somehow if you're having that, what feels like period pain or whatever in the middle of everything, of the middle of the cycle, when you're not bleeding, that may very well be a sign. That was a sign for me. And I was laying on the floor in tears, crying. And I ended up having not the 7, but the 2 surgeries. On the second surgery, I ended up with 1 ovary and a half of the uterus, right? Because they cut out the whole other half of the uterus to get rid of the endometriosis. I had a 9-millimeter cyst inside of the ovary the first time. And then within 2 years, because the endometriosis is so constant, every time you come on your period, there's growth, right? It just gets worse and worse. And so within 2 years of that first initial surgery, because I don't know if I'm saying this in a linear fashion so that you can understand it, but within 2 years of that first surgery where I had the big cyst, I then had the second surgery. They just had to cut out part of the uterus altogether. The same thing, Stephanie. The doctors continue to talk to me about get pregnant, have a baby. You can, that'll resolve this while you still can. And by the grace of God, I did. I ended up getting pregnant with my 1 ovary and my half of a uterus, and I got pregnant twice. So praise God. And so, there is some truth to that, because once I had the children, I did not have the cramping and everything. I just kind of flushed out everything. So, like Ricky mentioned, check know your body, and just having pain just out of the blue continuously, it's not normal.
It's not normal.
So just
not right.
make sure we're getting it checked out.
Yeah, and thank you for bringing that up too, Jan. Even as a teenager, I had horrible menstrual cycles, crawled up in a ball as a teenager. To your point, that's just not normal. And I would go to the doctors, and I was taking a leave back then. I was a teenager, but it was only till I was in my early 20s that I was finally diagnosed with that. So yes, if you have daughters or granddaughters that are experiencing that, get the extra testing done just to make sure to rule that out. Now, I'm sure I would like to think that endometriosis treatment has come a long way since my diagnosis. I'm not sure. I haven't been to see Dr. Paul McCool in a number of years, thank God. But I would like to think that there has been some advancement made with endometriosis treatment. So I don't know.
Yeah, and we now know so much about cancer that our Black bodies are different from white bodies. And a lot of the solutions that we have for all these diseases may not work effectively for us. You brought up another really important point, and I've been experiencing that with my mother, is UTIs. And I think as we age, they get more prevalent. And my mom has been fighting pneumonia for the past 2 years. And it all has been source and sepsis twice now in the past 3 months, but it came from a UTI. And she didn't want to talk about it. I'm like, Mommy, we have to think about where this is coming from. Well, don't tell people I can't clean myself. It's not about that. But I think that as we age, I think that's something we all have to watch out for, because it is a culprit.
Yes.
It comes from antibiotics, but you have to watch, the UTIs, because some of them are symptomatic. My mother's are not symptomatic either. She's not getting that burning sensation.
Mimic dementia.
Yeah, they mimic dementia. Yeah, I think, yeah. So a lot of elderly people are getting them. Just be careful. So your turn. So you know what? I love for you to talk about what you do in your day job, because I think you're seeing a lot of disease happen in our community, but then also talk about your book and what you really stand for, your advocacy platform.
Okay, great, wonderful. Thank you so much. And thank you for sharing your story. It's through sharing stories that these conditions that we have come alive, and they're real, and you can feel like it's okay to tell your story, because generally there are another 10 people that have that same situation. They're afraid to share it. They don't know where to go, and they're alone, and they're feeling like they're alone. So thank you for sharing that so much. I am a regional medical director for a company that provides healthcare to prisons and jails. I was on my way to retirement, and I flunked it, and was given this opportunity to work supervising doctors that work in jails. So my jails are throughout the country. Right now, I have one in New Mexico, 2 in Kentucky, and 1 in Texas. but I have managed care in jails from Iowa to the whole state of California and in between Michigan, and I'm about to get my license for the state of Massachusetts, which will probably be more for my friends when I come up here and they have UTIs. But that's what I've been doing since about 2010, officially regional medical director since 2014. I enjoy the work. I don't have as much direct care of patients because I'm in a regional role, and it gives me the opportunity to be able to do something different. I had done medicine for probably over 30 years. And so this gives me an opportunity to do a little bit of HR, a little bit of finance, business development, marketing, and I'm confident I have ADD. So this just gives me a chance to
With your girlfriend, we all have it.
every morning when I wake up, I have no idea what the day will bring.
God's in control.
Yeah, I have a few scheduled meetings, every day, but I never know what kind of problem I'm going to need to fix. So it's fun in the sense that I feel like I'm impacting and helping because I'm overseeing to try to make sure that the care that the detainees are getting is quality care. We are standardized most of my jails by something that you are familiar with through JACO for hospitals. It's a similar kind of a thing. So we have guidelines. A lot of people think those of us that work in correctional medicine can't get jobs elsewhere. Not the case. We choose to do it. I choose to do it because I feel like all of the healthcare pretty much that I have given has been for those that are underserved. I've worked for Planned Parenthood for 14 years. And I've worked in FQHCs for probably 5 or 6 years. And I've been doing this since about 2010. I sort of like taking care of people that I feel have real medical problems. Not that we don't have real medical problems, but I have taken care of quite a few of the worried well. And it just feels a little bit more rewarding to take care of somebody that has blood pressure out of control or diabetes out of control. These detainees, and I also say that to my doctors, they're not prisoners. They're detainees. They have been arrested and they have been identified, just like I can be arrested and identified and detained. They have not been convicted of anything. So also part of what I do is to teach my docs to treat these people with respect, Mr. Jones, Mrs. Jones, and to not promise them things that you can't deliver on, but to be honest. I love the work. I'm looking to transition though into doing something a little bit less, 40 hours a week. So because I want to spend more time here. And then
You can be on my board.
and we can talk. But the other thing that I really have a passion for is advocacy. And about a little over 10 years or so ago, my colleague and I wrote a book on how to advocate for yourself. And the passion behind the book was really all about medical experiences that I had had in my own family. So the stories that are in the book, the case reports are all real. We've changed all the names and the locations to protect the innocents for obvious reasons. But part of the passion behind it was my feeling was, if this is happening to my mother or my son or my daughter, and I'm sitting there at the bedside and they know I'm a medical doctor, then what happens to other people who are not medical? They're not nurses, they're not LPNs, they're not even medical assistants. And the medical environment can be very intimidating. And when you're sick, it is very, very difficult to advocate for yourself because you're hurting, you're scared, and there's information that you think will come to you and you really don't even want to hear it because you're thinking it's going to be something that's terminal. So we were motivated to write this book because we would go to things like this and we would share stories and everybody would feel like it was really good information, and that they could take it to where they needed to go. But we felt it needed to be just sort of put together in a book. We tried to go to companies and to work with corporations through their HR department. We were given a big stop sign. They didn't want us in there. We tried to convince them that if we talk with employees and help them better be able to communicate, navigate, and then advocate, then they'd be more productive. So we talk a little bit in the book about how to talk so the doctor will listen, how to talk so you can actually get that 3:30 afternoon appointment for your child and not go sit in the emergency room all day and miss a whole day of work and watch all the chest painters, the gunshot wounds, the stabs, the head traumas roll right past you in the emergency room because you're not that acute. Because what you have is not what really needs to be in the emergency room. It needs to be in your doctor's office as a, an urgent care appointment or something like that. We also talk about the importance of and how to ask for a second opinion, because every, having a relationship with a doctor, there's chemistry. And sometimes it works and sometimes it doesn't. I will say to you, as I've said to many, if you live long enough, you'll end up, if none of you have any doctor's appointments other than your annual, just keep on living and you will find that there's somebody else. And so I'm at that point now where I got a bunch of doctors I need to see. And I actually had to fire one of them last year. I talk about this, it's been in my book, and I found myself in a situation saying, why am I staying here? Why am I tolerating this? I go around the country and speak about, firing your doctor. And I had two of them actually. Both of them had not been appropriate. And so I had to make a decision. I said, I'm going to fire both of them. But then I had to be logical. You have to really think about your situation. There are not a lot of doctors out here. So it's sort of like, well, you're going to yell at the person where you're here at the vineyard, but if you don't have a place to sleep, you're in trouble. Yeah. So I had to really think about, are you going to really fire these people? Why are you firing these people? What is it that they did or didn't do? So I made a decision to really only fire one, the one that I thought was the most critical, and to find another one. And then I said, let me wait. And then after I've gotten established, don't leave yourself high and dry firing doctors, let me tell you, because it's not easy to get another appointment. So I waited, and then God stepped in. I had to see the second doctor that I was going to fire. I went in there with a problem that was unrelated to her condition, but she jumped and said, let me get that test for you. And I'm going to order it stat. And let me order this for you stat. And she just marched me through a whole nother area of medicine. And I walked back and said, okay, God, I guess I needed to slow down, because sometimes some of the anxiety around you feeling that you need to fire is within you. And so it's important that when you make that step to do that, that you really know what you're doing. We teach in our book that effective communication and savvy navigation leads to appropriate advocacy.
Say that again.
Effective communication, savvy navigation leads to appropriate advocacy. I do not believe that you can advocate if you cannot communicate. And if you cannot navigate, then you cannot advocate. So you've got to be able to understand the lingo. We have a glossary in the back of our book. So there are some acronyms that are there that will help, help you. You need to be able to understand the lingo. You also need to understand navigation, which means what kind of insurance do you have? Just because you work for a 5-star company doesn't mean you're going to get 5-star health care. And that needs to be very clear across the board. So many people think, oh, I work for so-and-so, I got the best insurance. But if you don't go to the doctor, and if your doctor is really not paying attention and listening to you so that you can get the test that you need, or if you don't understand what in-network and out-of-network is all about, you're going to be stuck with a lot of medical bills. So communicate, navigate, and then you can advocate. In our advocacy, we also want people to understand that you don't have to be a doctor to be an advocate. You just have to pay attention. Your daughter can be your advocate. If your daughter spends time with you and knows that every day you do this, that, or the other, and they notice that somehow your behavior has changed, your daughter can go in with you to the doctor, because usually what happens is we say, how are you doing, Mrs. Jones? Fine. The daughter or the husband said, no, she's not. Yeah. Right? So that person needs to go in with you. Don't ever go to an emergency room by yourself. Never. Don't go to a doctor's appointment where you're going to get a pathology report by yourself. Because once the doctor says cancer, you don't hear anything else that he or she says. You're just shut down. They can tell you it's completely treatable, 100%. And you walked out with your head hung down saying this is it. So advocacy can be done by friends. Of course, it can be done by colleagues that are in the medical field. The more medicine you know, the more questions you can ask. And of course, as physicians, I advocate for folks all the time. I hate to admit this, but I will say that when a doctor knows that another doctor is overseeing the care changes. It's, yes,
Or a lawyer.
or a lawyer, that's true. But it's sad, and I don't know why that is, but it's sort of like that. And sometimes you don't have to integrate that person but once or twice, because then they know you've got that support in the household and that somebody's going to come back and ask.
I've had that happen, Dr. Glenda, where I've been kicked out of a few FaceTime doctor's appointments with patients, but actually one of our patients, the doctor actually Googled me while the patient was in there, like, who is this heifer on the phone with you, asking all these questions. But we do, and we will FaceTime with anybody. Our navigators will FaceTime with anybody because it's so important. We also find that doctors spend more time with you when somebody else is with you. That 15 minutes can turn into 30 if you have someone there with you, for sure. Yeah, so thank you for that, because it's so important. It's so important not to go alone, you know? Yeah.
Thank you all, and Stephanie, thank you for being here. I don't want to shift gears too much, but my mom is 81 and we live in different cities. And so I'm often concerned about her care. And so what we started to do, she's been really good about it, is, Mom, let's write the questions down that you're going to ask the doctor.
And so, thank you. So that has been helpful, but I wanted to just hear from, if you all have other suggestions of ways. You just mentioned FaceTime, and I was thinking, I wonder if I could FaceTime into some of her appointments. So I just wanted to know if you have thoughts about that long distance. She's in she's in fairly good health, other than her knee bothers her. I tried to get her to have surgery forever. She's not doing that, so that's not going to happen at this point. But other than that, she's on high blood pressure medication on and off over the years, but she gets around, she lives by herself, she cares for herself, all of those things. But since I'm not there with her, when I do see her, I can see that Mama's aging now in ways that I hadn't noticed before.
So I'm happy to talk about that. I managed my mother's care for many, many years. She just passed away in March at 107.
Oh.
So I was really blessed to have her, and she had multiple diagnoses. If you saw it on paper, you would wonder how on earth she could live that long, but she kept faculties all the way up until the last 2 weeks. So we were blessed. But this is what I will share with you. I would recommend that while she's well, that you make every effort to go with her to her doctor's appointments, for the reason to establish that eye contact with that doctor. So when that telephone call comes in from you, you're not a person that lives in California or Maryland, you're her daughter. And that doctor, he or she, has put a name to a face. So the other thing I often say to people is, go to the doctor when you're well. I mean, when I was young and I was having babies, I would go in to see my OB doctor, and my weight was usually up, but occasionally it'd be down. And the doctor would look at me and she'd say, "What's going on?" I said, "Well, why?" She said, you're losing weight. I can see it in your face. What's going on with you? So doctors need to see you in the good times, so that they totally understand you in the more difficult times. If your doctor really knows you, all they have to do is walk in the room, and they can tell by your facial expression whether this is going to be a lively, and the appointment may not be about their health. The patient may be suffering because their grandchild isn't being appropriately cared for, or the daughter just lost their job, or their issues. But I encourage, go to the ophthalmology appointment, go to the primary care appointment, go while she's well. And then that way, when there is a problem, you can pick up the telephone and they know that there's a name to a face, to a loved one that cares about it. And the calls will go on, because we were calling Mama's doctor until the very last day.
I would definitely support that. My mom is 92 and I know all the doctors. They all know me. I'm a pain in their butt. I will call them, my mother as well. We're doing really good. We haven't had an issue for a couple months. And I definitely build a relationship with the doctors,
Let me give you one trick. This little trick. I don't know that a lot of people do it, but this is what we did. My mother had, I can tell it now because she's passed on. She never let us tell it, but she was a breast cancer survivor and a colon cancer survivor. And so
Bless her.
obviously that tells you about my history.
Yeah.
But none of those diseases took her out. It was a stroke that took her out at 107. But one of the things that we used to do, the first surgeon that went in that did her breast surgery, we were just so, and my sister's a doctor also. We were so enamored with the doctor, we went out to the store and we bought him the baddest shirt and sweater and brought it back to his office and dropped it off, just so grateful that she had made it through the surgery and all of that. 8, 9, 10 years later, she comes up with colon cancer. And I'm sitting in the waiting room waiting for them to tell me that she's okay. And he had told me that the surgery would be, an hour and a half or something. And we're in 2 hours. And I'm just sitting there, oh, Lord, what's going on? They called for me to say, come to the front. I thought it was that call that things weren't going well. They said, oh, no, the surgeon wanted us to let you know that things are going fine. But he found a little bit more in there than he expected. And he feels that her heart is good enough to stay on the table, and he's going to track and pull all that cancer completely off of all of those ureters to try to be able to improve her longevity. And we turned around and we got him something else after that.
Right.
And then when mom would go into the hospital, we would always bring bagels to the nurses station. Let me tell you, working in a hospital, we do a lot of eating there. It's nervous eating. And so I always, when mom is in the hospital, we bring bagels to the floor, put your name on the outside. This is from Mrs. Jones, bed 2276A. I'm telling you, they know when she rings her bell, they go because they all benefited from the bagels. And don't just stop with that. Come in another day with something else. This is something my sister and I have done. We're both doctors. We eat it. We know what we do. When we are working in the hospital and who brought that food in? So it is a way of caring, I feel, and giving love to the people that are caring and giving love to your loved one, because not always can the nurse assigned to your mama be the one that's going to respond to your mama's bell. It may have to be a nurse that's got another patient that takes time out of her, whatever she's doing. So be good and be kind to the people that care for your loved ones, because I think it will matter too.
I totally support that. The Ward 3 and Walter Reed, I know all the nurses. I bring them food, I bring them lunch, I bring them Starbucks, and they know me. They know my mother's been there probably 6 times this year, but they know it. And I still bake a pound cake for my chemo nurse and send it to her every nurse's day because she took care of me. It's been 13 years. I still send her a pound cake every May 5th. But you have to do that because they're people and they work really hard. They work really long hours and they are taking care of your people. And I used to spend the night in the hospital with my mom. And now I feel like I don't have to because I brought the lunch. Because I know they're going to watch over her at night when I'm not there. You know what I mean? But you need the advocate.
Just a quick story. So I lost my mom during COVID. She had, my mom had sickle cell, but not the full-blown disease. She had a rare form of the trait called sickle cell SE. So what that meant is she could get a crisis maybe once every 10, 15 years. She just happened to get a crisis during COVID where no one could go into the hospitals. So my sister dropped her off. They came out in a wheelchair and took her on. Don't worry, we'll take very good care of Miss Cummings. She'll be fine. Took her in, kept her 24 hours. And I remember when my sister dropped off, she said, I've never had pain like this before. She was 76. So she stayed there overnight, came home, she's feeling a little bit better, didn't get any better, took her to another hospital in New York, Albany Medical Center, which has a sickle cell triage. Went there, dropped her off, couldn't go in. Talked to her that evening. I said, well, how you doing? She said, oh, I'm just in so much pain. By now, we're on day 3. Usually, the saline and the pain medications would have started to kick in. She would have started to feel better. So let me speak to the doctor. He says, well, we're giving her all the pain medicine that we can possibly give her, Stephanie. We can't give her anymore. We just continue to monitor her and, we'll update you again. Now, what I didn't realize, the hospitals were very chaotic during that time, right? I said, Mommy, let me speak to my mom. I said, whatever you do, don't take that mask off. I know you're in pain. Just keep that mask on while you're in there. She said, okay. It was about 6 o'clock in the evening. I said, I'll give you a call back later on that evening. At midnight, I got a call that she had coded and went into cardiac arrest and was on life support. I said, well, what happened? You know, we were just very mixed information, kept calling back. I did get a nurse, probably shared a lot more information than she should have. She said, well, your mom, someone, the person in the room had called. She was very flustered. The roommate had called us and told us to come in and check on the lady in the bed. I said, well, what does that mean? Was she falling out of the bed? Didn't really get a whole lot of information. Long story short, we lost my mom. They called my sister up around 2 or 3 o'clock in the morning. Still, she was on life support. We believe my mom was already gone. They said, why don't you come up and sit with her? Now, when my sister got there, they continued to perform CPR multiple times on her. Glenda, my sister saw all this. They were on the bed, banging on her chest. You know, her head turned, blood came out because they had cracked her rib cages by that. A lot had happened. And so, long story short, to this day, my sister's convinced they probably gave my mom too much pain medication, which caused her to go into cardiac arrest. We'll never know. We didn't want an autopsy. I just did not want that happening. My mom was gone. I didn't want them cutting her open or doing any of that. We just accepted it and we moved on. But it was so unfair. And my story is not unlike any others that lost loved ones during that time, right? You couldn't go in. You just drop off your loved ones and that's it. You pray. You have no idea what's going on. Everyone was overworked. It was chaotic. But I have accepted the fact that that was her time and that, you know, God called her home at that time. And she was still so very young. But it is important and everything that you said, because I was always that advocate. All my family's gone now. My parents, my grandparents, it's just my sister and I. But we were the biggest advocates. And to your point, Dr. Glenda, when you go in and they meet you, oftentimes they come up with all these preconceived notions of Black people. We're ignorant, we're poor, we don't know what we're talking about, we're not going to understand. But when you go in there and you're articulate and you're well-dressed and you're educated, and I was flying in from Washington for as many things as I could for my grandparents, medical care people are going to come at attention because they're going to know this is just not some willy-nilly Black woman coming in here checking on her granddaddy, right? You're going to get the attention. And I do believe you have to be nice and kind. I took care of a lot of special nurses during COVID. Even after I lost my mom, I was sending whole nursing stations food, my sorority and all my chapters, because we knew how overworked they were and they appreciated that. You know, they really did. So I paused there.
My mother has told me to go home and change my clothes when I came to visit her at the hospital. Go put on some pants, like take those sweats off. Like go comb your hair. Come back tomorrow, come back in an hour, but go make yourself look better when you're here with me. And go get my makeup. She'll also say, don't fly a plane in your sweats.
It's fine. Hi, thank you for this is the magic of the vineyard, right? I had no clue that was.
Say that again.
This is the magic of the vineyard.
That's a soundbite. Wait, say that again. That helps us get money.
Yeah, the magic of the vineyard. I was just visiting friends at their home and they said, come go with us to this talk. I'm Delegate Kim Taylor. I work in the House of Delegates of Maryland. I'm also part of the Willow Oak, Maryland chapter of Links, one of the charter members there. About sometime last year, I was approached by a young woman at a reception, and her name is Lauren Renee Cornegie, and she's the founder of Indo Black. And she introduced to me plans, actually it's a federal legislation introduced by Nikema Williams in the House of Representatives. This particular legislation is intended to make critical investments in endometriosis research. Oh, wow. So there is some efforts to improve the quality of care in the endometriosis space. And in Maryland, she has come to me and others to sponsor legislation. And I was thinking that maybe Dr. Newell, you would know this, that there may be a gene that if identified would identified a predisposition to endometriosis, and maybe on the state level, we can ensure that insurance companies fund that test. So maybe you can.
Yeah, I can't personally speak to that, but I'm excited to hear that this is going on.
Yeah,
I will have
very
to say though that what troubles me the most about what's going on in this country right now has to do with blocking the clinical trial work.
Yeah.
That's what, because we are going to be the people that we already were not in the studies like we should be, because some of us are still dealing with Tuskegee.
Yeah.
And we don't really understand the value of us being in these studies, so that when the decision is being made for you to get a certain treatment, then those people that were in the study look like you, walk like you, act like you, participate in the things. But it opens up a lot of doors. Many of these genetic tests are extremely expensive, and insurance companies will refuse to pay for them. And they are not in addition to like the scan that you were telling me about earlier today, the breast scan that really is only covered through. So this is really, these BRCA tests and so forth, they are part of routine medical care with certain medical conditions. But that's the other piece about advocating. You have to get on the telephone and you've got to start having conversations. I almost said argue, but you don't want to argue, but you're needing to have conversations. I think to your point, the biggest thing are clinical trials.
Yes.
We've got to get involved in the
Got
clinical trials, because in the absence of us being in the trials, we are being treated. You know how they talk about this was studied in mice, and we're giving you a medication because it was studied in mice. It's similar that if we are not studying medical medications that are in people that look like us, then it's a wild card. It really depends upon how much is in your ancestry that may not be Black, that really helps you to then be able to survive, because the decisions are made based on that. So I'm excited to hear about this with endometriosis. It's really kind of another quiet disease, a bit like fibroids, that people suffer with them. And there's really not a lot of conversation about how people need to be managing these diseases.
Please stay so we can get your information. And Meryl, I live in Annapolis, so please stay. Yeah, I know. You can bring it up. But you know, Brooke Lehrman is our family, so we will, you know, get her working on something too. But you know, with the clinical trials, we can't emphasize it enough, and the genetic testing, we can't emphasize it enough. But still know that the genetic testing was based on white bodies, and we know in breast cancer, our cancer is different. And I think it's true for other diseases. We just haven't done enough research on Black people, right? Just research on Black people. So if you need a clinical trial for anything, specifically for breast, we can find it for you. We've now signed up 28,000, over 662 Black women for our clinical trial portal. But it's not enough, because we know that the clinical trial participation needs to be commensurate with our burden of disease. So whatever disease we have to do it for Black people, and we can help you find a trial, though we'll always find somebody. Because
So in general, how do you find a trial? Like, I have a coworker whose mother had, let's say, uterine cancer, and I, because I know you, was pushing, oh my God, you have to get her in a trial, you have to get her in a trial. But the doctors were resistant to get her into a trial. I also have lipoprotein A, and would be interested in possibly exploring getting in a trial.
we'll get you in one. Lily's doing a bunch of them. Novartis is doing a bunch of them. So, you know, doctors don't invite us. And, you know, you mentioned Tuskegee. And so, you know, I did a manuscript a few years ago from a research study that we did. And Tuskegee's out there. Henry Alexis, people are thinking about it. But the two main reasons why Black people don't participate, Black women, are one, doctors don't invite us. And a lot of them don't even know about the trials, or they elicit bias, racism, whatever. The number two reason, but equally as important, is I think I'm going to get a sugar pill and die. And they don't understand the mechanics of how a clinical trial works. And for cancer, think about it this way. First of all, you know the Advil you took last week, that Motrin you took, it was in a clinical trial. The heart medicine I give my dog Harper was in a clinical trial. But think about it. You have the ice cream, the chocolate syrup, the whipped cream, right? For regular medications. For a clinical trial, you have the ice cream, the chocolate syrup, the whipped cream, and a cherry on top. So you're going to get the sundae, but you're going to get the cherry on top. You're going to get standard of care. You're going to get the best medication we have, plus something better or something incremental to it. And I think when we speak to people and explain it in words they can spell, from a voice of trust, a voice of a blessee, a voice of a patient who's been through a trial, people sign me up. I don't want to die. You know, and I'm only alive because I did a clinical trial. I would be dead. You always are, my friend.
Whenever you about a medication, the fine or the fast talk after talks about liver and kidney damage. So my fear is that if I'm not that I won't join a trial, I'm just sharing my fear, is that taking experimental medication, the reason they know it could cause liver or kidney disease is because the people in the trial got it. So do you have any advice for me?
Well, every drug has side effects. Every drug you take has side effects. And you know, kidneys and liver are always kind of at risk for everything. I mean, I have residual effects from the chemo that I took for breast cancer. But I think you have to outweigh what the benefit of the drug is for the disease that you're dealing with. And frankly, in a clinical trial, you have more people watching over you and prodding you and poking you and checking you and scanning you, that you're in a better position than if you were just on a drug. I watch women now, she's gonna kick me out now, my boss over here, but I watch people, if you go on a normal chemo regime for breast cancer, you're probably not gonna get a scan to see if the chemo is working for about 3 or 4 months into the chemo. If you're in a clinical trial for breast cancer, you're gonna get scanned every 3 or 4 weeks, and you're gonna know that that drug is working or not, and they're gonna change you up. So you really are getting better care, a better quality of care. We also know for cancer, there are better outcomes in a clinical trial situation than in regular treatment. So I think it depends on the drug. I can't speak to everything, but you're going to get so many people checking you out and making sure you're okay and giving you and monitoring your side effects. And that's what we do with our nurse navigation. Experience and help you with the resources you need to deal with the side effects, but also to understand the complications. Does that make you feel better?
Well, and I'm not going to take her testimony like Ricky, but you've hit the end of the road. What else do you have to lose? You might be given 6 more months to live and that's it. Why not take that risk of doing that trial with the side effects?
But don't do it as the last resort. Do it as a first resort. We see in breast cancer, if you have triple negative breast cancer and you're under 40, women, that's what I had. Your best treatment is a clinical trial because we don't have the drugs for you. And your best treatment option is a clinical trial. So don't look at it as a first resort. It's the best medicine we have. We have a friend, Karen, we can play a video of her. She actually did a phase 1 trial. Now, a phase 1 trial is only about 10 or 15 people, right? Because they're checking for safety, right? They're checking for how to fare against the current drugs that we have. But a phase 1 trial, a lot of people go into it as a last resort. My friend Karen, they gave her a 3% chance of living with her triple negative metastatic breast cancer. She did the trial, she's fine. That drug never made it to the market. That drug never made it to the market and it hasn't been released yet, but it cured her cancer, triple negative breast cancer. I don't know, you know, and it wasn't even for breast cancer. It was a special trial for some other drug, but she went on that trial because she wanted to live.
Yeah. And the point here is that
the thing that like might work, right? Because like the current medicine is not proven to work on our bodies. If it did, we wouldn't be having these conversations.
Especially for things like triple negative, especially for things.
We're gonna take one more question.
Hi, my name is Francine, and I've been in education. I was an educator for 34 years of teaching, print administration, and all. I retired, and I was able to retire very young, at 55. Like I've been retired over 15 years now, and I'm involved with community things and stay active that way. But now at 73 years old, I'm finding that I'm losing I'm down on myself. My doctor that I had for many years retired and left me with a PA. And that PA is not, even though she was attached to the doctor, she still doesn't have that, inside of me, and what makes me click and all of that. And so I'm frustrated with myself. And maybe it's because I'm not in data, because I was at the top of what I did in education, going to the homes, went beyond all of that, when a child wasn't doing what they're supposed to do. And now with the time on my hands, the doctor tells me, I did an MRI, nothing came out, with it. And I'm telling the PA, I'm still forgetting. Well, she set me up with psychiatry, and I guess it's over the phone. But even to get into that, your insurance, and I have top insurance, Tufts Medicare preferred, and they're not accepting that. And in the meantime, I'm frustrated. I get frustrated at a lot of things because I'm not working my brain as I did on top of everybody and everything. And so now being retired, I don't have that input. I'm not into anything that's really stimulating me or keeping me where I was and where I was left off. So I'm in a ball of confusion a lot of times within myself. I just don't feel like I'm on top of my game and like I'm forgetting and, but you asked me that question already, so I want a good medical doctor, which is very hard to find, or someone that, that I could be referred to. And I just, I'm in a ball of confusion.
You sound like you live in Boston.
Yes.
That's it.
And I live in Springfield now, but I'm born and raised in.
Where's your family?
In New Bedford. But my mom, my mother, my father have passed. I'm the oldest of right now. I was the middle child, and my oldest sister passed away. And so, and my brother, he's older than me, but a year and a half older than me. But, as far as the stability and the one that was the glue that, like, with my mother and father, I'm that person, but I don't live in the midst of them. I'm by myself in Springfield. So I don't really I have a family, a community, because I've been in education for so long and people and with that, but I don't have that core knitted, connection, with my family, there. So there's just a lot of missing pieces, and I am in a ball of confusion.
Do you have kids?
I don't have any children, but I raised my
nieces, nephews.
Yes, I raised my two nieces. They were my sister's children. I raised them from babies, but now they're on their own. One has 4 boys. She's kind of like in a confused state of her own, but I chime in as much as I can, but I can't raise these kids. I can't keep these kids 24/7. I do as much as I can. And the other daughter, niece that I raised, my daughter, she's in Virginia. I don't get to see her as often, but we connect through phone or talking. So I have 5 grandchildren through my nieces, that I try to stay in, and they've got a lot going on,
So I want to thank you for sharing. And I also want to let you know that many of us are having challenges with our memory. So I want you to know that, I talked to some 50-year-olds. I'm way past that. But the whole notion of kind of not remembering, I want to tell you that some of it has to do when you're very, very busy. When you have a lot of things going on, it's very, very hard to kind of keep track of that. The second thing I want to say to you is you need to find an MD or a DO. I love physician assistants. I love PAs, but you need a doctor. Okay? You need a doctor. And this business, and this is no disrespect to mid-level providers. I work with them all the time and have been supervising nurse practitioners and PAs for 35 years. But there is a difference in our training, and there is a difference in our experience. And if you are having a situation and it's being cured for by a PA or an NP and everything's going well, great. But when it's not, you need to step it up a notch. I encourage you to talk to your friends. The best referral for another doctor is another patient. So talk to your friends and find out if you're connected with a church. Find out who some of your church members are that are seeing. You need a new doctor. That's the first thing. And then maybe there might be some people within your church or any other organization that might be able to sort of support you. You may find in talking with the doctor that there may be something that's going on. There may be something that they can give you medication for. But to have a problem and to continue to go to the same medical provider and you get the same old story every single time, that's the time. I won't necessarily say to fire your doctor, but you need another opinion. And you need to get an expert in the field, because sometimes those of us as primary care physicians, we don't know everything. You need to someone that may be an expert in memory care, things of that nature, put you through the proper tests. But to just look at you and say your MRI is negative and I don't find anything wrong, you know something is wrong. As Ricky has already said, you know your body, you know what you were able to do, and you need to keep pushing until you can get somebody to get you the answers that you.
I was an Aspen Ideas fellow this year, and I went to a conversation on aging. It was led by AARP, and I learned so much about truly the thing that like really reverses aging is having a purpose and remaining purposeful in your life and have those activities. It might not look the same as it once did. It might no longer be, swimming or whatever that dating activity was. It could be bird watching, right? It could be I'm now an avid reader. But like having that purpose and finding purpose in every day really was something that they talked about reversing or like being a huge addition to aging. But I think it's a much larger thing to talk about because life expectancy is getting longer. What a great problem to have, right? But that means that we have to think about what caretaking now looks like, not burdening our families, not family members, not doing things that we're not fit to do because we're not MDs, right? And having to manage that. That's really tricky to figure out. And so I think it's right now such a family decision on how you make those changes and a personal one too, because we took my grandmother's keys from her one day and she went out and bought a new car the next day. She was like, oh, hell no. You know what I mean? And it's like, that's just not how we do this. She was like, oh no. You know what I mean? And so like, it's not easy to figure that out in families. It's not easy to like, be there for each other in the way that you want to when most of us don't have the skill set to do that. Especially when dealing with like all the various kinds of dementia, right? That's a huge topic. And so I would say be easy on yourself in this regard, because I don't think that you should like These are all things that are happening to many people, and you're definitely not alone. So I do think finding community is crucial here. So any last thoughts before we close up, guys?
Thank you, guys. I look across the street.
Thank you for inviting me, Ricky. This has been wonderful. I love coming to this island. I've been coming for over 35 years, but it's been something very different this time to know that while we're vacationing, that you can make time to care for ourselves, because we've got to put our own mask on because we're clearly taking care of so many other people. So thank you for inviting me.
Thank you, Ricky, and I appreciate you extending the invite to me. You know, when I share my story, it's just my testimony. And if anything that I shared can help the next person that's coming along, that's experiencing these, symptoms of this horrific disease, and I can make their road a little bit easier than it was for me, I'm here for it. So thank you for having me.
I think the takeaway from these last 2 weeks is,
The takeaway from these last 2 weeks, and we've been talking about everything, is be the CEO of your own health. Be the CEO of your family's health. Know your body, know your history, know her story. We have a great worksheet in our bags that we're giving out called Know Her Story that Haley developed. She's a teacher, so everything's a worksheet. You can do it online, but you can sit down with everybody in your family at a family meal on the beach, on the porch while you're here, and know what people have. You just put it out there. Know your numbers. Know your A1C, your PSA, your blood pressure. When was your last mammogram? Talk to the men in your family. Everybody's connected. We know there's a connection between breast cancer and prostate cancer and colon cancer. Be diligent about your health. You're in control of a lot of things. Take a walk. Talk to God. You're right here in a beautiful space. You can do that at home. You don't need a gym membership. You don't need to pay a lot of money for it. It's all right here in nature. So just take a walk. Get a dog. I walk my dog every 2 miles every day. But I think, we can be healthier as a people. So take responsibility for that, and be the CEO of your own health, and check the breasts that you love. I know you have a pair. I know there's a lot in your family that you care about. So check them. We'll be here next year. We're so excited to do this work. It's my God job. And next year I'll have another baby with me. But we're, just take care of yourself and take care of your families, enjoy your vacation. But use this as an opportunity. You're here with your families. Talk to them. Pull all the stuff out of it.
And just to close us out, clearly we're having a links panel next year because that has to happen. So please, do all the things that were said here. Take all the advice, act on these things even when no one's looking. Keep your appointments. We're closing out our programming that we've had for 2 weeks, which is so nice, but we still have a couple more things going on. Today, we are doing a movie screening of the Whitmore Project, starting in just an hour. So we're gonna do a quick turnover. We have a very exciting Touch talent show that might just feature us staying in this house, but come enjoy it.
Count as a talent.
Lip syncing count. If you want to hold the mic, we'll turn it off. Do what you gotta do. We also are hosting our first annual booby trap party tonight. So if you want to come and dance and have a good time, please join us. And lastly, we want to definitely thank all of our amazing sponsors for allowing us to be here, which includes ARP, Gilead, Exact Sciences, ASI. ASI actually provided these little fanny pads that are in the bags, and those are for endometrial cancer because they do have a little mirror, so you can just check everything out. Also Daiichi Sankyo, Pfizer, Merck, Novartis, AstraZeneca, and our biggest sponsor, Genentech. And if you would like to participate more, please scan this QR code. On this QR code, you'll find a place to donate. If you want to donate to get a t-shirt, a scarf, a fan, because you're going to be doing the fan dance tonight, please do that. There's also a really, really important survey that helps us come back next year and provide even better education for this community. So please scan, enjoy, grab a snack, and then we will hopefully see you guys later on today. And enjoy this last beautiful day as well.
Make sure we have your information.
Oh yeah, if you did not sign our sign-up sheet, please do so because we want to be able to contact you. We are often on the road and we'll probably be in your city. Not me right now. but the team definitely will. So sign up, do our survey. If you want a paper copy of the survey, I have those as well. So thank you guys all for coming, and one more round of applause for our panelists.
Okay, have a good evening. Thanks for watching. See you next week. Next week we have a great show. We're going to have 8 lovely young metastatic blesties talking about our Pathways to Peace program that we just piloted at a retreat in Georgia. So see you next week. Blessed love. Take care. Happy Father's Day to the dads out there this weekend. Bye.